Welcome to the Cancer Council webinar on nutrition and exercise after cancer. My name is Meg Chiswell and I work in the Cancer Council in the Cancer Information and Support Service. I will be your facilitator this evening. This webinar is for people who have finished active cancer treatment, such as chemotherapy or radiotherapy. If you're someone who is still undergoing cancer treatment, we would like to let you know that the information for you is different. We have another webinar coming up in September that will cover nutrition and exercise during cancer treatment, and we encourage you to register for this webinar through the Cancer Council website. From our registrations, we are aware that there are a large number of health professionals who've registered for tonight's webinar. Although the webinar is for people who have finished active treatment, we do hope that tonight's webinar is informative for you. Tonight's webinar will be recorded and made available on the Cancer Council Victoria website. For those who have undergone treatment for cancer, you may wish to review this again or recommend it to others. For our health professionals, we encourage you to tell your patients about the webinar as an additional information and support resource. Before we begin, we would like to acknowledge the traditional owners of the lands we are meeting on today. We also pay our respects to their elders, past and present, and all Aboriginal people participating today. About this webinar. Tonight's webinar will run for an hour and a half. The first section of the webinar will consist of presentations from our expert panellists and a panel discussion. For those of you who have not participated in a webinar before, you do not need to do anything during this time except sit back and enjoy the presentations. You may like to have a pen and paper ready to make some notes or jot down some questions you would like answered later in the night. Towards the end of our session, we will have a live question and answer segment. At this time, those attending the webinar can post a question to the panel using a question and answer function in the webinar software. During the question and answer time, there will not be a live presentation or audio that you hear, but you will be able to read the questions and answers that are submitted and then answered by the panel members. I will spend some more time explaining the question and answer section and how to work this function later in the webinar. If you have any connection problems during the webinar, please call the numbers on your screen. As I mentioned before, the webinar will be recorded and made available within the next week on the Cancer Council website. You will receive a link to the webinar in a follow-up email from the Cancer Council. The recording will not contain a record of the questions and answers. If during the webinar or after the webinar you feel like you still have questions, please remember that you can call the Cancer Council on 13 11 20 and speak to a cancer nurse between 9 a.m. and 5 p.m, Monday to Friday. You can also email a cancer nurse outside of these hours. During the webinar, some of the presentations will have links to resources or relevant websites. These links are not live during the webinar. You can't click on them, but they will be provided to you after the webinar in a follow-up email. In Australia, there are more than 750,000 people who have previously been diagnosed with cancer. Many people diagnosed with cancer now live a long time after treatment. Cancer survivors may be at an increased risk of other health problems, including heart disease, type 2 diabetes, and functional impairment, which can be alleviated through lifestyle interventions. On the basis of the available evidence, Cancer Council Australia supports the adoption of a long-term healthy lifestyle following a cancer treatment to improve quality of life and reduce the risk of cancer recurrence. The end of treatment is a time that many people realise the impact that cancer has had on them, their family and friends. Many people who have had cancer want to live a healthier lifestyle after cancer treatment and choose to think about setting new goals and strategies to help them do this. This can be challenging, as for many people, things may not be quite as simple. Goals and strategies are different for the during treatment and after treatment phases. As I mentioned before, Cancer Council has an upcoming webinar in September to address information and recommendations for during treatment. Tonight, I'm delighted to let you know that we have a panel of expert presenters who will talk about nutrition and exercise strategies after cancer treatment. We will also be featuring 2 programs that can be accessed through Cancer Council to assist people adopt a healthy lifestyle. The full biographies for the presenters this evening are located on the website, and I encourage you to revisit the website if you would like to learn some more about our presenters. Our first presenter this evening is Dr. Anna Boltong. Anna is Head of the Cancer Information and Support Service at Cancer Council Victoria. She has been an accredited practicing dietitian for 16 years with her PhD in supportive care in cancer, investigating the needs of patients and clinicians in managing chemotherapy-induced taste dysfunction. Thank you, Anna.
Thank you, Meg. I'm delighted to be speaking into the webinar this evening, especially because this topic has been requested so often since we commenced our webinar program in 2013. As Meg said, the content of this webinar is very much tailored to people who've completed cancer treatment. In this sense, the health promotion messages really revert back to cancer prevention messages, and these prevention messages are perhaps even more important for people who've already had cancer. We know that lifestyle interventions for cancer survivors are showing potential to improve health and well-being. There are many topics that I could cover this evening, given the hunger for information from cancer survivors, but in the interest of time, the key areas to be discussed are those that you can see on the screen. Weight changes, either weight gain or weight loss, during and after treatment are common and often unwanted. In addition to weight changes, other nutrition-related side effects of cancer treatment can persist long after treatment has finished, so I'll touch on these as well. And finally, a common challenge for people wanting sound nutrition advice after cancer treatment is where to find credible sources of it. This can be particularly difficult once you've finished active treatment and have less contact with your hospital treating team. Unwanted weight loss is common in people who've received cancer treatment, and generally speaking, this occurs because of either reduced calories consumed from food, or where you are consuming the same amount of calories as you always did, but because the demands of cancer itself and cancer treatment on your body needs more calories than it ordinarily would have. If you've lost weight recently without trying and have been eating poorly because of decreased appetite or other eating problems, you may be at risk of malnutrition. Malnutrition occurs when there is an imbalance of energy, protein, and other nutrients. Many factors can increase the risk of malnutrition when you have cancer, and that includes the cancer itself and the part of the body that's involved. So, for example, if the cancer involves the head and neck or the gastrointestinal areas, including the stomach or the bowel, it may be more difficult to swallow and digest food. Cancer treatments such as chemotherapy, radiotherapy, and surgery can also increase your energy and protein needs, and side effects from cancer treatment may make it more difficult to eat. For example, a dry mouth or taste changes or swallowing problems. Being unwell in hospital can also lead to weight loss that's difficult to regain. And some of the listeners may never have regained weight loss during your hospital stay or across treatment periods because of a disruption to your usual routine, which includes eating when and what you want to and not being limited by things like hospital food or lengthy periods of chemotherapy or fasting for surgery, and perhaps other factors like being in temporary accommodation, which means that you get out of your usual routine with eating. Stress and anxiety is another common contributor to unintentional weight gain, as is fatigue and loss of energy. Some common changes include eating less than usual or feeling full quickly or not eating between meals. If you're less active than you were before, then your appetite may have decreased accordingly as well. Your dietitian may suggest some dietary changes and provide you with information on a diet high in energy, so that's one that's high in kilojoules or calories, and protein. They might suggest that you eat smaller and more frequent meals that are more nutritious than perhaps foods that you were eating previously, or suggest different foods that might be easier to chew or swallow. Nourishing drinks, including milk drinks or special nutrition supplement drinks, can also be useful, and the resources that are mentioned on this slide give a starting point for this advice and include what to look out for with regards to malnutrition risk. On the flip side, weight gain can be common during or after cancer treatment, especially with certain types of cancer like prostate cancer or breast cancer. It's not usually expected and almost always unwanted. And there's evidence that being overweight or obese can increase the risk of cancer coming back and can also increase the chances of other chronic health conditions such as diabetes and heart disease developing. Weight gain can happen for a variety of reasons, including treatments such as steroids, which can increase appetite and lead to eating more, being less active, often because of fatigue or getting out of your usual habits, and dietary changes often made to accommodate the burden of cancer treatment and its consequences. Also, metabolic changes as a result of the disease itself or hormonal changes and changes in body composition can lead to weight gain. Unfortunately, there's only really one remedy for this if you've gained unwanted weight, which is to move more, that is to be more active and to consume less calories. And this can be especially challenging following a cancer diagnosis. But there are a number of ways to achieve this, as well as some great community resources that Alison, Andrew and Clem will cover off on in the remainder of the webinar. The resources and programs you'll hear about during this webinar are designed really for some supported self-help. One key take-home message that I did want to reinforce tonight is about the amount of food eaten. So many people make some really healthy changes to the types of food they eat, and that's extremely positive. Alison will talk more about what dietitians call portion control, but I did want to take the opportunity to reinforce how important it is to be conscious of how much food you're serving yourself or that gets served to you on a plate, and really to reflect on whether the amount of food that you eat is a product of habit more so than the amount you actually need to manage hunger. And we find that that can be a key way to move forward for people who are trying to manage their weight at this time. Reducing the amount of alcohol is also really important because not only can alcohol contribute to unwanted weight gain, but there is also some evidence that more than 4 to 5 drinks per week can increase the risk of some cancers coming back. The general recommendation for an upper limit of alcohol intake is no more than 2 standard drinks per day, and it can be really tricky to understand just what one standard drink is. So there's a slide on the next page that is a helpful guide for this. Not everyone who needs to lose weight does so with the help of a dietitian. However, if you are planning to see a dietitian, it's helpful to take along a food diary to your first appointment. Your food diary should contain a record of everything that you've had to eat or drink, including quantities, in the last 1 to 2 weeks. And this really helps a dietitian make a more detailed assessment of where dietary improvements could best be made. The resources listed here, or the resource on this slide, is not so much a practical resource for strategies to employ to lose weight, you'll hear plenty of those next, but rather a summary of the evidence for the benefits of healthy eating and increased physical activity after cancer treatment. It provides a rationale for Cancer Council Australia's recommendations for cancer survivors, and it's developed in a wiki platform that allows the document to be constantly updated with the latest evidence. So this is the slide on alcohol that I explained. There's not a lot of time to talk at it this evening, but it is perhaps a useful tool to look at or to download later. You'll notice there that 100 mils of wine is classed as 1 standard drink. And this actually equates to just 5 tablespoons of wine, which is almost never the portion that's poured. So I would encourage you, if you're listening, to measure out 100 mils of a fluid that doesn't need to be wine into a glass at home and have a look at how much that is. The serve that you would receive at a pub, or perhaps if you served yourself, could easily be as much as 3 standard drinks in one pouring. Nutrition-related side effects of cancer treatment can last long after treatment has finished. And these can be particularly tricky to manage, especially if you're not surrounded by the extended medical team who are caring for you during your cancer treatment. Sometimes these symptoms actually appear well after treatment has ceased, and these can be known as late effects. These symptoms have implications for nutritional status and food enjoyment. Other than changes in weight, these issues can include ongoing taste and smell problems, appetite changes or reduced enjoyment of specific foods or of foods in general, and gastrointestinal problems such as changes in bowel functioning or frequency, especially as a result of bowel surgery or radiotherapy to the abdominal region. I list these symptoms because these are the most frequently mentioned nutrition-related problems from callers to our 13 11 20 cancer information and support line. We've worked with dietitians at the Peter MacCallum Cancer Centre in Melbourne to develop first-line messages for nurses to provide to callers with these issues. Our nurses can help you get to the bottom of what might be causing your symptoms and can send you in the right direction for more specialised advice if necessary. They can help find the right health professionals in your local area or back in your original treatment team and can work with you to pose specific questions to take to your healthcare provider. Cancer Council Victoria's latest fact sheet, Understanding Taste and Smell Problems, helps explain why you might be experiencing symptoms that can affect how you perceive the flavour of foods and what you can do to help overcome these problems. This fact sheet, which was informed by my PhD in this area, addresses an information gap conveyed by people affected by cancer and their health professionals. For any of the health professionals listening in, there is also a clinician resource to be released soon on the EverQ website that is a collaboration between Cancer Council Victoria and EverQ, and this link will be provided in the fact sheets that get developed and disseminated following the webinar. So finally, where to go for dietary information? One of the biggest health-related challenges that people grapple with following cancer treatment is where to go for credible information. It can certainly be very confusing with a myriad of health messages and fad diets and the like circulating to know where to go for accurate information about your health. 13 11 20 can be phoned in any state to access cancer-specific health professionals to help you navigate through this maze. You'll hear about some wonderfully accessible programs run through Cancer Council this evening. You're also encouraged to contact your local community health centre to find out what health promotion programs they have on offer or whether they have nutrition or exercise professionals working there for individual appointments. A list of all community health centres in Victoria can be found at the Community Health Directory shown in the link here, which can be accessed by the Victorian Department of Health. To find an accredited practicing dietitian, you can go to the DAA website, and that has a link on the home page to something called Find an Accredited Practicing Dietitian. Clicking on this link will take you to a page to fill out some information to find a dietitian that suits your needs. Here you're able to list the postcode you live in and select areas of practice that the dietitian must offer, for example, cancer or oncology. A person can self-refer to one of these dietitians at any time, and it's an idea to contact a dietitian ahead of your appointment to ask about their cancer-specific experience and their willingness to treat cancer patients. Finally, for health professionals listening in, there's a link there which is to a recent publication by Wendy DeMark-Wainfried and colleagues in a cancer journal for clinicians in March this year, and that provides an overview of practical interventions that have resulted in favourable improvements in lifestyle behaviour change in cancer survivors.
Thank you, Anna. I would like to remind everyone that our panellists will be available to answer questions at the end of the session in either our panel discussion or our Q&A session. We'll hear more from Anna at the end of the session. I'd now like to present Andrew Manane. Andrew is an accredited exercise physiologist and is working across Peter Mac and On Track, the Adolescent and Young Adult Cancer Service. Andrew has over 9 years clinical experience in prescribing targeted exercise programs aimed at improving cancer patients' outcomes through exercise. Thank you, Andrew.
Thank you, Meg, for the introduction, and good evening to everyone listening out there this evening. So exercise plays a role in cancer in three main ways. Firstly, it plays a role in cancer prevention. There is good evidence to show that by maintaining a healthy body weight and undertaking regular exercise can decrease the risk and incidence of some cancers, in particular those of the breast and colon. We also utilise exercise during the treatment phase, as research has shown that exercising during this time can help manage treatment-related symptoms such as fatigue, and it can also improve one's physical functioning and quality of life. Finally, its major role is in the recovery process. People who engage in regular physical activity and exercise return to their pre-morbid level of functioning sooner. It helps to facilitate a healthy and active lifestyle, and in some tumour groups, it has been linked to decreased recurrence rates and improved overall survival. So post-treatment, people often experience a range of physical effects which can have a significant impact on your physical functioning and therefore ability to participate in physical activity. Some commonly reported effects include poor coordination and unsteadiness, decreased muscle mass, strength and weight, nausea and vomiting, along with fatigue, just to name a few. You may experience one or more of these physical effects, but the good news is that with the right mix of exercise and the correct timing of getting started, physical activity can help minimize and reverse these side effects. So you're all probably wondering, I have a number of these side effects and I don't feel like undertaking physical activity. What happens if I don't exercise? Well, there are both short and long-term effects of inactivity, and this applies to everyone listening, not just those who have undergone a cancer treatment. After 2 to 4 weeks, you'll start to notice a change in your cardiovascular function, decreased strength, and endurance. Long-term inactivity is something that we all need to avoid, as research has shown that leading a sedentary lifestyle can lead to a number of different chronic health conditions, including cardiovascular disease, diabetes, and depression, and as I mentioned before, can increase the risk of cancer recurrence in some tumour groups. So there's been a number of research studies exploring the effects of physical activity programs on the health and well-being of people affected by cancer, both during and post-treatment. US researchers conducted a systematic review and meta-analysis of 82 studies of physical activity interventions for cancer survivors. Results showed that during the post-treatment phase of the cancer journey, participating in activity had a positive and significant impact on one's aerobic fitness, upper and lower body strength, lean body mass, and overall quality of life. And the table here lists the exercise modality with the expected health benefit you will receive. In a nutshell, participating in regular physical activity after cancer treatment can optimize your health and well-being, increase your energy levels, help to rebuild muscle and regain strength, and enhance your appearance and confidence. So how much exercise should I do post-treatment? As you can see here, the exercise recommendations for cancer survivors do not differ greatly from the general population. However, it is important to remember that if you have been inactive for some time, you will need to start slowly and gradually work your way up. Some key things to remember. For good health, you need to undertake at least 30 minutes of moderate intensity activity most days of the week. To decrease your risk of developing cancer or further chronic health conditions, you need to aim for at least 60 minutes of moderate activity or 30 minutes of more vigorous activity each day. It's important to limit your sedentary activities such as watching television or using the computer. If you find 30 minutes of activity difficult in one go, you can break this amount up into small components over the course of the day, e.g. going for 3 10-minute walks. This is particularly helpful if fatigue is an issue. It is also important to include some resistance training or weight training into your weekly routine, as this will help to strengthen both muscle and your bones. So before taking part in any exercise program soon after your cancer treatment, it is important to talk to your oncologist or GP as there may be some contraindications and or precautions that you need to consider before getting back into a regular exercise routine. If it has been a while since you have been active or your fitness levels are low, you will need to start slowly and build up gradually. Try not to do too much too soon. Exercise should not be expensive. A walking program only requires a pair of runners to get you started. Starting a program may be overwhelming and you may have lots of questions. You may then benefit from seeing an exercise professional, such as an exercise physiologist or physiotherapist, to help with your exercise program. And finally, the most important thing is to choose an activity or program that you enjoy, as this will promote long-term adherence and compliance. For most cancer patients, there are cancer-specific precautions that you need to keep in mind when starting an exercise program. If you have lost lots of weight, you may need to limit yourself to light-intensity exercise due to the loss of adipose tissue and skeletal muscle mass. If you experience bone pain or have compromised skeletal activity, you should avoid activities that increase the risk of fracture, such as contact sports and weight training. If you experience peripheral neuropathies post-chemotherapy, you may have some weakness and or balance issues. This does not mean that you cannot exercise, but you may need to modify the type of activity you undertake. Therefore, riding an exercise bike may be a better option than going for a walk out in the community. You'll also need to be careful in water environments. Chemotherapy can have an impact on your immune system, which increases the risk of infection. So it is always a good idea to check with your medical team prior to getting back into a pool. It is normal to experience setbacks as you start or return to physical activity. The following I find are some useful strategies with patients when I work with them at Peter Mac. It's a good idea to choose an activity that is both enjoyable and challenging. If something is too hard or too easy, you will lose interest pretty quickly. It can also help to have a variety of different activities that you undertake over the course of the week. Goal setting is a very important process and something that I do with all patients. You need to include both short and long-term goals when undertaking this process. Putting exercise into your weekly schedule and planning ahead can help those who say they have little time to exercise. By keeping an exercise diary of your exercise sessions can be beneficial, as this will allow you to monitor progress over time. Technology really helps in this area. Devices such as Fitbits, heart rate monitors, and phone apps work really well and do the work for you. And lastly, acknowledge bad days. Things will not always go to plan. How you feel day to day can fluctuate. Try not to let it get you down and ask for help if you need it. The last thing I want to mention are some options and resources for people out in the community. Oncology rehab programs have really gained some momentum over the last 2 years and run at a number of different health services and organisations. For those not familiar with such programs, they normally involve a nurse, a physio and or EP who run a 45 to 60-minute exercise session twice a week for 6 to 8 weeks. And there are also a range of number of private programs that operate out in the community that are quite similar. If you want or need some additional help and would like to access an EP in the community, you can make use of the Medicare benefit schedule, which allows a person to attend 5 sessions per year with an allied health professional. Speak to your GP about this program, as they will need to make the referral. And finally, the Cancer Council has lots of good resources, including the booklet Exercise for People Living with Cancer, which talks through most of the things that I've covered here tonight. Thank you.
Thank you, Andrew. We've now heard from 2 of our panellists about the role of good nutrition and an active lifestyle for those who've finished active cancer treatment. We've also heard that there are many practical strategies and where to find credible information and resources and how to get started with an exercise program. Our next presentations will focus on some of the programs and tools that are accessible through Cancer Council. Our next presenter is Alison Jin. Alison is an accredited practicing dietitian with 7 years' experience in public health and obesity prevention. Alison currently works for Cancer Council Victoria as LiveLighter Campaign Manager and is joining us tonight to tell us some more about LiveLighter. Thank you, Alison.
Thank you, Meg, and good evening, everyone. My job tonight is to take you through about LiveLighter and what it can offer you, and I'll be doing that by looking at who it's for and what LiveLighter is, and then we'll look at the healthy tips and the tools and resources offered by the campaign. So to start off with, I'll just take you through who LiveLighter is designed for. So LiveLighter helps Australian adults achieve and maintain a healthy weight. It's designed for both men and women. And the tools, resources and recipes are suitable for people who are either living in individual or small households and also for families. If you're cooking for 1 or 2 or a smaller household, you might want to reduce the quantities or freeze some of the leftovers. The content's not designed for children or adolescents specifically in terms of the recommendations and tools on the website, but they can still enjoy the recipes that are on offer. And the content's also not appropriate for people who are underweight or who are taking nutrition supplements or losing weight without trying. If that's you, you're better off looking for nutrition and exercise advice from your dietitian or medical professional. The LiveLighter campaign is also not for frail elderly people, as they've got different nutrition requirements from younger, more active adults. But for most other people, who are probably the majority of you listening out there tonight, and definitely for most people in the community, the LiveLighter recommendations are suitable for you. So that brings us to what is LiveLighter. It's delivered by the Cancer Council with the Heart Foundation, and it's funded by the state governments in Western Australia, Victoria and the ACT, and it's a healthy weight campaign. The website's available for all Australians and people overseas as well to use. LiveLighter aims to encourage Australian adults to lead healthier lifestyles and to make changes to what they eat and drink and to be more active. We want to help people understand why they need to take action and what simple changes they can do in order to live lighter. We know that weight gain doesn't just lead to extra weight around the waist. It also causes a build-up of fat around your vital organs, and the scientific name for this type of fat is visceral fat. We commonly refer to it as toxic fat, though, because what it actually does is release chemicals into the body, and these chemicals increase your risk of heart disease, type 2 diabetes, and some cancers. We know that the fat around the organs is the most dangerous fat, not just the fat under the skin. So because of this, we encourage people to measure their waist rather than just weighing themselves. And this website helps you to measure your waist, and then it directs you to tools that can help you to achieve and maintain a healthy weight. So I think you might have been told earlier in the presentation that you could just sit back and relax for this part, but I'm actually going to do a little bit of participation at home now. So to measure your waist, if you're doing this for real, you'll need a tape measure. You can get those cheaply from the supermarket, or your doctor may have one they can give you. And how you measure your waist is to find the top of your hip bone with your fingers, and then also find the bottom of your ribs. They should roughly line up. And the next part is to breathe out. If you breathe in at this point, when you come back to do it again later, you're going to have a hard time seeing whether your waist has changed or not. So just breathe out and relax, and then you place the tape measure around the narrowest part between the bottom of your ribs and the top of your hips. And wherever the tape measure comes around and meets again, that's your waist circumference. It's a good idea to write down the number that you have, because if you're anything like me, you probably won't remember it later on. And this can be a really useful way of seeing how your weight's tracking over time, particularly if you are trying to lose some weight. If you don't want to write the number down by hand, you can record it on the LiveLighter website, which will keep a record of for you for later. If you need these instructions that are on your screen now, you can find them again later on the LiveLighter website. And there's some numbers down in the bottom left corner of the screen that indicate the risk. So your risk of type 2 diabetes, heart disease, and some cancers is lowest when your waist circumference is less than 94 centimetres for men and less than 80 centimetres for women. So you may want to aim to be under that range, but we also know that any reduction in waist circumference above that is beneficial for reducing your risk. So another goal that you could aim for is, for example, losing 5 centimetres from your waist. We also have a few calculators on the LiveLighter website which are free to use. The first one is the one on the right-hand side, which is the sugary drinks calculator. So you can go in there and put in how many of each of the different types of sugary drinks you have in a week. It then tells you how much sugar you're drinking, and you can use this to track if that's reducing if you're aiming to do that. And the other risk calculator is to calculate your risk of developing type 2 diabetes, heart disease, and some cancers. So you've got your waist measurement now that you've done that, and you can also put in your height, weight, and your gender in there, and then it gives you a recommendation on whether you're at risk or not for those types of conditions. If you're making changes to your exercise and diet, you can come back later and do this again and see how your risk has changed. Once you've had a go at the risk calculator, then you can move on to the meal and activity planner, which is tailored to your needs based on what you entered into the calculator. And once you've started doing that, you can track your changes in your waist and your waist circumference and your weight here. And then you can see how you're going over time. So there's an example up there where somebody probably didn't enter anything on their first week, but after that their waist and their weight has been reducing and they're now in the recommended ranges. There's also a silhouette which shows you roughly what you look like based on the measurements that you've put in, and that can be really encouraging to see that changing as you're making healthier changes. And the final tool that I'll take you through tonight that's available on LiveLighter, I'm not sure if I mentioned earlier, but everything on this website is free to use, including the meal and activity planner. And this is a 12-week plan which is on offer to you. It's tailored to your needs based on your measurements which you entered earlier. And it starts off, this is the first day of the meal plan, and it recommends what to eat for each of your main meals. It also tells you how many snacks are recommended for you and gives you recommendations of what snacks to eat. As you go along, the recommendations become less strict and you can make more choices in those yourself. So it just helps you to look at the portion sizes, and then you're free to make changes as you go along. If you have any special dietary requirements or foods that you prefer not to eat, you can go to the panel on the right-hand side of the screen, which says energy equivalent food stocks and special dietary requirements, and you can find in there information on how you can swap the things to make them work for you. If you still have further questions, you can click on the Ask Us button, which is on each page of the website, and the campaign dietitian or one of the team will respond to your query. Thank you.
Thank you, Alison. Our final presenter this evening is Clem Byard. Clem is a clinical nurse specialist who works on the 131120 Cancer Information and Support Line at Cancer Council Victoria. Clem has a background in supportive care research and is currently coordinator of the Healthy Living After Cancer program. Thank you, Clem.
Pardon me. Thank you, Meg, and hello, everyone. So I'm here tonight to talk about an exciting new program that we've got called Healthy Living After Cancer. It's a program for cancer survivors, and it's a completely telephone-based program. The program's aiming to improve people's diets, to increase the amount of exercise that people get, and to help them achieve weight loss. So, as I said, it's a completely telephone-based program, and people receive up to 12 phone calls over a 6-month period from a specially trained cancer council nurse. So it's quite an involved program. As some of the previous speakers have discussed, we know that people who are cancer survivors have ongoing side effects from treatment, including including fatigue, pain, emotional distress, and lots of other things. Fatigue's a particularly common one to be reported. People are concerned about cancer recurrence, and they're at risk of chronic health conditions. We know that the regular exercise and a healthy diet helps reduce the incidence of cancer recurrence, chronic diseases, and improves many of the side effects, but it also is, having side effects makes people less inclined to, probably get out and exercise as much as they should, and the majority of cancer survivors don't currently meet established guidelines. And that's where Healthy Living After Cancer, we're hoping, can help people break that cycle. So as part of the program, as well as the kind of phone calls with the cancer nurse, people receive a workbook. This has got lots of tips and advice about diet and exercise, and the content of the book has been developed with dietitians and exercise physiologists. I know Anna was talking about how difficult it can be sometimes to know what information to trust, and so the information in this book is in line with current guidelines, so you know that what you're doing is the sort of thing you should be doing. So another part of the program involves quite a involved questionnaire that is conducted over the phone before you start the program. Then you receive some feedback based on the information you give, and it compares in a kind of easy-to-read graphic form what you're doing currently with what the guidelines recommend. There's also another questionnaire at the end, so you can see how far you've come. And the program's conducted between the University of Queensland, 4 of the cancer councils around Australia, and it's an NHMRC partnership program. So, as I mentioned, it's a 6-month program and has up to 12 phone calls. One of the elements of the program is that it has a tapered call schedule. So at the start of the program, you'll get a call every week, and gradually, as you build up healthy living habits, the calls decrease to once per fortnight and then once per month. So you can continue with the healthy living habits by yourself at the end of the program. So one of the key things that Healthy Living After Cancer focuses on is motivation. We know that motivation is a big challenge, and keeping up these behaviours in the long term is difficult. So there's a great focus on that. Some of the other behaviours that other speakers have already mentioned are self-monitoring, so checking how you're going and setting yourself goals. We particularly focus on making small, achievable changes. And the program's quite flexible, so it can accommodate people who start at a fairly low level of fitness or low level of knowledge, as well as people who are already doing better but have specific areas they'd like to work on. So just to mention the eligibility, we're looking to target people who've got had localised cancer, so non-metastatic cancer, and have completed treatment within the past 5 years. The program's just started a month or so ago, and we're looking to run it into 2018. For more information about Healthy Living After Cancer, you can call 13 11 20 Cancer Information and Support, and there's also a website that you can visit, which has got a video that explains more about the program. Thanks, Meg.
Thank you, Clem. At this time, we'll be joined by all of our panellists for a short question and answer session. I would like to pose the first question to Alison and Clem. From the snapshot of the LiveLighter and Healthy Living After Cancer program, it looks like there's a place in these programs for people to document their goals and measure their success. My question is, how do monitoring tools help people make changes to their lifestyle?
Thanks, Meg. The most effective changes that anybody can make are things that you can keep doing over a long period of time. And recording your progress can really help you stick to it. That's why we really encourage people to use the tools on the LiveLighter website or to make a note of what they're doing at home. And Anna also mentioned earlier how important the portion sizes are in terms of weight control and also keeping to a healthy diet. And keeping a record of what you're eating can really help you to keep to your healthy portions.
So certainly Healthy Living After Cancer has some sort of pen and paper tools for tracking what you eat and what exercise you do, and there's also a fridge magnet that you can use to write how you've been going on it. But I think from our point of view, the exact tool that you use is not as important as the fact that you're doing it at all. So people could use a spreadsheet on their computer, they could use a diary, there's websites available that you can use for tracking it, like the LiveLighter website, and there are numerous smartphone apps that can track these kind of information, and any of those are completely fine. The importance, from my point of view, I think, is that these kind of tracking of your diet and exercise helps give you an accurate idea of what you're doing at the moment, can give you an idea of areas where you might be able to improve, and the fact that you can kind of track your progress means that you can set goals for yourself, little changes that you can make, and probably the most important thing is that when you see the progress that you're making, that's one of the ways you can get some kind of good motivation. You know that you've got it, made achievements in the past. So, yeah.
Thanks, Clem. Clem, can I ask a follow-up question? That is just around the monitoring that's done by the nurses during those calls. Would you like to talk a little bit about if they assist with that monitoring process at all?
Sure. So I suppose fundamentally what we're trying to do is build up people's ability to monitor themselves and empower people to kind of take control of their own diet and exercise. But we certainly think that it's important for people to set concrete goals, things that can be clearly measured. And so we sort of talk through that process with people to help them set goals and then check back with them, record what people have said they're going to do, check back with them in the future to see how they've gone and reassess the goals after that. So,
thanks, Clem. Anna, the next question is for you. From your research and clinical practice experiences with people who gain weight during and after cancer treatment, when's the best time to really start that conversations about strategies to lose weight?
Thanks, Meg. Well, firstly, I would say it's never too early and it's never too late to have that conversation. I think our old-fashioned advice was to tell people not to worry about watching what they eat and trying to be physically active during cancer treatment. Now we've got much more evidence to suggest that those who do gain excessive weight can have poorer outcomes into the future. Also, people don't want to gain weight. It can come as a shock, and it's an additional nuisance really to some people who are already facing all the other medical, physical and emotional side effects of cancer and its treatment. I've heard patients in the past say that they hoped chemotherapy would have a silver lining, that they would get a bit sick and not be able to eat, and that would help them shed a few unwanted kilograms. They are then surprised and disappointed when this is actually not the case. Equally, some patients I've worked with have never had to worry about their weight before until they've been treated for cancer. I've heard people say that they wish they'd been told, or they say things like, my doctor said it could happen to me, but I thought they really meant other people and that it never actually would happen to me. So it is something that can be difficult to grapple with at the start of treatment, especially when there's many other priorities happening for a person and there's a lot going on. But the other part of it is that because of that, clinicians, including dietitians, might be reluctant to flag weight gain as a possible side effect of treatment or to address it as it happens just because it falls lower down the priority list with so much else going on for a patient. I think diagnosis and early treatment can be a time of an overwhelming amount of information, but we do need to get better at routinely letting people in high-risk groups, such as breast cancer groups, for example, know that weight gain can happen to them and what they can be mindful of and where to go for help. So waiting to address the issue until much later can make the weight loss efforts even more challenging. However, it is never too late. So I think patients can start the conversation during what we're starting to hear being called the prehabilitation phase. So that is the period between diagnosis and perhaps the first big treatment, so surgery, for example, and continue those discussions with the medical team throughout contact with them. And really the best thing that a patient can do is know what's available to them, both within and outside of the treatment facility after treatment's finished.
Thanks, Anna. So, Andrew, the final question I have is really, it's one that was submitted a number of times by some of our webinar participants, and that's about the idea about it being reasonable to expect that it's possible to return to pre-cancer levels of strength and fitness. Would you be able to discuss that a little bit?
Yeah, not a problem at all, Meg. It can sometimes depend on your cancer type and the types of treatment undergone. But for most people diagnosed with cancer, there is no reason why you can't return to pre-cancer levels of fitness. And I have definitely seen many people who have had better fitness. Running marathons seems to be a goal that people like to do post-treatment. The most important thing, and this is what I tell everyone, is give yourself time to get there. It will take a minimum of 3 to 6 months and sometimes take up to 12 months to get back to where you were pre-cancer diagnosis. I often find people jumping straight into the same exercise routine that they were doing pre-diagnosis, despite not exercising for a number of months. They find it difficult or too hard and they become discouraged. Have a clear goal in mind, make a plan on how to get there and start slowly. Allow yourself time to gradually build up and you will eventually get there.
Andrew. Alison, one more question. We've heard from our panellists tonight and also from our 13, 11, 20 oncology nurses that after treatment many people really have issues with ongoing fatigue and perhaps they might not have the energy to cook healthy and fresh meals regularly. Do you have any suggestions or practical tips that might assist these people?
Yes, I do. Thank you. That's a really typical question, and I think this is something that comes up not just with cancer patients, but a lot of people struggle with this. One thing that you can do if you do have the energy to cook sometimes is to try and cook bigger batches and either keep it in the fridge or freeze it if it's going to last for longer. And this can just mean that you don't need to cook every day. If you need to rely more on bought food at this time, check the nutrition information panel, which is on the back of the packet. If you're not sure what to look for on that pack to see whether it's a healthy choice or not, check the LiveLighter website. There's a wallet card which can help you choose healthier options by looking at the fat, salt, sugar and energy content of foods. And the other thing is if you can manage to add some vegetables to your meals, that's a really great way that you can improve the nutrition of those bought meals. So even a packet of frozen vegetables added to them will really boost the nutrition of that.
Awesome. We'll hear some more from our panellists during the Q&A session that will commence shortly. But to wrap up our panel discussion, I'd like to ask each of our panellists for a key message for people who've finished active cancer treatment. What's your top suggestion or your key message for people tonight? Can I start with Alison?
My take-home message would be to make small changes which fit with your own lifestyle, and in this way you'll be able to sustain them.
And Anna?
I would say don't put up with nutrition-related side effects of cancer treatment, and they include unwanted weight gain or weight loss. So if you're no longer connected with your treating team, then you can call 13 11 20 to speak to a cancer nurse, and they can help you navigate the health system for the right information and support.
Clem?
So I kind of put a little bit of emphasis on the self-monitoring and goal-setting side of things. It can be very annoying, I suppose, when you haven't been in the habit of doing these kind of things before, but once you've sort of broken the ice and done it for 2 or 3 weeks, you'll find that it becomes quite a natural process. So.
Thanks, Clem. Andrew?
Okay, so regular exercise is essential for long-term health and well-being. Your target should be about 30 minutes of moderate intensity activity each day. If you're having a hard time doing this or regaining your fitness, talk to your medical team and look to link in with an EP or physio to help you on your way.
Thanks, Andrew. I'd like to thank our panellists for sharing their knowledge and for providing us with some excellent advice and practical strategies on the topics tonight. Our panellists will be available until 8:30 p.m. to answer your questions. There may be quite a number of questions that come up in this session tonight, and I just wanted to reiterate that calling the Cancer Council Victoria on 13 11 20 is a fantastic place to have questions answered and be directed to appropriate support